Next, we're going to talk about the infant of a drug or the drug exposed infant. The effects of drugs and medications on the infant depend on the dose and on how much of that drug crosses the placenta. If the patient is using, if the mother has been using illegally obtained substances, then those may have been cut with other substances, and we don't always know exactly what they've been exposed to. So another thing to be aware of is that a lot of users use multiple substances. So tobacco exposure is it's the most common drug exposure. Tobacco causes decreased perfusion in utero, which can lead to intrauterine growth restriction, oligohydramnios, a small placenta, fetal hypoxia, intrauterine fetal death, and abruption. All of those things connect to decreased perfusion because tobacco has nicotine as a vasoconstrictor. Infants who are exposed to tobacco in the home are at risk for asthma, pneumonia, and ear infections. Alcohol, if the mother consumes a significant amount of alcohol consistently during pregnancy, the infant may actually experience alcohol withdrawal. Infants that are exposed to, that have been exposed to alcohol in fetal life. So with chronic alcohol use in pregnancy, we can have something called fetal alcohol syndrome. And what they've discovered more recently is that even lower amounts of alcohol can still have some effects on the fetus. So the effects on the fetus tend to be somewhat loosely connected to alcohol dose. So someone who drinks very heavily in pregnancy, their infant is much more likely to have fetal alcohol syndrome. Someone who drinks occasionally, they're more likely to be on the lighter end of these symptoms, but it's not a perfect dose correlation. So what are some of those effects? We may see growth restriction. We may see microcephaly. With severe fetal alcohol syndrome, the head actually stops growing because the brain is not growing very well. We may see there's a specific set of facial features that are common. The eyes may be small, the upper lip thin, the midface may be kind of flat. Sometimes these kids will have some developmental delays due to a difference in IQ. They may also have ADHD. They may have difficulty with fine motor skills, with speech, with inhibition and judgment and decision making. They may have tremors, hypertonia. They may be very tense, and as infants, they may be difficult to console. So the effects are on a really wide continuum. Sometimes we don't actually see a lot of those effects until they get older and they're going to school. With opiates, neonatal abstinence syndrome is withdrawal in a baby. Neonatal abstinence syndrome is most common with opiate medications, but it can occur with some other substances. What does that look like? That baby may be irritable. They may actually have seizures depending on the substance. They may be hyperactive, not sleep well, have a high-pitched cry, tremors, an exaggerated startle reflex. The muscles may be hypertonic, maybe too tense. They may not feed well. They may have diarrhea, vomiting, dehydration. They may try to feed, but they can't coordinate sucking well. They may not move food through the gut effectively, so they may have higher gastric residuals. They may have sweats, fever, mottled skin, stuffy nose, tachypnea. They may move around so much that they actually have some skin excoriation from that, and they may have a hard time regulating the temperature. And again, we may see some of those withdrawal symptoms with any substance. We are most likely to see the most severe ones with opiates. Cocaine causes poor perfusion in utero. Cocaine is a strong vasoconstrictor, so it causes poor perfusion. Anything that interferes with perfusion can lead to what? Pause and write these down and then see if you were right. Okay, premature birth, intrauterine growth restriction, abruption, oligohydramnios, intrauterine fetal death. Babies exposed to cocaine in utero may be preterm, may be SGA. They may have elevated heart rate and agitation. They may not have as many effects that are visible right away. They may have neurologic symptoms that persist throughout the neonatal period, like alterations in how active and reactive they are. So there's some controversy over the long-term sequelae. There was a big thing in the 80s about crack babies, babies who were exposed to crack in utero and how they had long-term deficits. There may be some possible learning disabilities, but some studies have really shown no difference in long-term in intelligence. So that may have been overblown partly due to bias. Methamphetamine, also a strong vasoconstrictor, causes poor perfusion in utero. So all the things that require perfusion, we may have those issues with meth as well. In addition, babies exposed to meth in utero may have cleft lip and palate or cardiac defects. Neonates withdrawing from meth may be agitated, vomiting, tachypnic. They may have abnormal sleep patterns, poor feeding, and disorganized behavior. They just don't respond to the world the way a typical newborn does. Marijuana does cross the placenta. The effects of that are undetermined. Very little research has been done on marijuana as a substance because it's been illegal to do that research until fairly recently, or very difficult to do it legally because it's been listed as a Schedule I for so long. So some of the things we know or we think about marijuana exposure may be connected to cross exposure with other substances and tobacco. They do think that it likely decreases fetal growth and may be associated with attention problems. And if someone uses marijuana heavily and then has a baby, that baby may have some abstinence symptoms. SSRI antidepressants. I want to make it clear that we are not going to recommend people not take their antidepressants. They really need to address that with their providers. But if the mother was taking an SSRI after the baby's born, they may have some withdrawal symptoms. And that may, again, look like hypertonia. They have too much excess muscle tone, tremors, difficulty sleeping, high-pitched crying, and feeding problems. So there may be some association with SSRIs and persistent pulmonary hypertension, and SSRIs can transfer to breast milk. However, frequently, that just needs to be addressed with a pediatrician. Frequently, people who are breastfeeding are able to take their antidepressants safely. Management for drug exposure for neonates. We really want to try to identify the mother early in pregnancy and promote treatment so that we minimize the negative effects on the fetus and the neonate. Okay. Punitive measures have really not been shown to be helpful, and they tend to actually make people hide their use more, and so it may be more difficult to actually help those people. So that becomes a political issue frequently. Just be aware that punitive issues haven't been shown to be really useful. So what can be done and what do we do? Typically, if there is a concern about potential substance use, that person who's pregnant will have a urine drug test. The infant, the neonate, we can do urine, meconium, and hair follicle testing. There are laws in each state about when and how that needs to be referred. So, it may be that you don't refer because the mother's positive, but if the infant is positive after birth, then that would be a referral. So you need to know what the law is and stay current on the law where you work, because that has actually changed over my career. Supportive care for that infant, they need to have meds as needed to manage the withdrawal symptoms, minimal stimulation, usually lots of holding and swaddling, ensure that they're getting adequate nutrition and hydration. Breastfeeding if it's appropriate. One thing you need to know, we are going to discourage breastfeeding for patients who are using cocaine, methamphetamine, and things that are obtained on the street because we don't know what's in it. But if a patient is an opiate user and is on methadone, methadone is considered safe for breastfeeding, and it actually can help decrease the severity of those withdrawal symptoms for the baby. We also want to assist that parent with caretaking and promote bonding, and we want to assess whether that baby's going home to a safe environment.